Patients who develop slowly progressive facial weakness, well, these are the patients that you really have to be concerned about tumors actually of the facial nerve, not tumors around the nerve, tumors of the nerve. And what happens here is that the outermost covering of the nerve is coated by Schwann cells. And Schwann cells produce myelin. Well, myelin is very important in the conduction of nerve impulses. What happens here is that Schwann cells start to grow faster than all the cells around them, and this produces a tumor. Although initially it involves the outer part of the nerve, it may then secondarily invade the nerve and cause progressive weakness. Because they're slowly growing, these patients develop slowly progressive facial weakness. This is a very, very distinct and separate entity from Bell's palsy. Not every patient who has a facial paralysis has Bell's palsy. Well, how do we treat these facial nerve tumors? Well, it's very important for us to know where that tumor is. And the facial nerve has a very complicated course. And if we look at this model, we can try to outline the course of the facial nerve. Well, the facial nerve leaves the brain, back here in the brain stem, and then traverses through this canal, the internal auditory canal, and then the nerve travels between the components of the inner ear, the cochlea, the semicircular canals, and makes a right angle turn. And it forms a ganglion, known as the geniculate ganglion. This ganglion then shoots off a branch to the tear glands. And the bulk of the nerve then travels through the middle ear, around the stapes bone, finally comes out through the stylomastoid foramen, fancy term for a small opening in the skull base, and then finally, as it comes out, it branches into its separate divisions and hits all the facial muscles. Treatment of a facial nerve tumor is tailored to where that tumor is and what the symptoms are with the patient. In patients who have some evidence of facial function, we are more apt to decompress the nerve. That is, remove the bony covering over the nerve and allow expansion of the nerve naturally. And in many of these patients, these tumors grow so slowly that they don't cause any trouble thereafter. The facial nerve paralysis may recede and may actually get quite better with decompression. And the facial paralysis may improve or stabilize.